Welcome, I'm your host, Dr. Noah. I'm going to be doing 21st Century Natural Health materials that I usually do on my TV show at napavalleytv.org on Monday nights 7 to 9 on channel 28. And so what I'm going to do is review the scientific literature of the last week and kind of keep you up to date in terms of the cutting edge in terms of what makes you and your family safe and happy with using natural ways. First report comes off in terms of just information. The multiple sclerosis drug fails. The BioM Medical Corporation did not meet the primary endpoint. Relapse rate and MRI did not work out right, so that drug works. So I've talked on my TV show about MS in terms of other types of natural approaches. It's an autoimmune disease that has lots of different types of natural things that can be done. Article from the Journal of Pediatrics, January 2009, Boston University. 3 months premature birth increases chances of autism by 300%. Another very devastating type of problem used with natural means very, very effectively. Lose weight helps ease female incontinence. This was a large study from the National Institute of Diabetes and Digestion and Kidney Disease, January 2009, all peer-reviewed medical journals. 13 million women, 10 times a day, of having different types of urinary type of problems. By losing weight, they're able to reduce the incontinence by 47%. There's lots of surgery and drugs out there. Simple type of approach that I talk about on a weekly basis in terms of obesity is the new epidemic. Different types of chemicals in our plastics. The bisphenol A lingers in our body. This is from the Environmental Health Perspective, January 2009. Showed that plastic, PVC pipe, dental sealants, and especially baby bottles of it, lingers way beyond just the 24 hours. In a Journal of American Medical Association 2008 study showed that these particular compounds increase medical disorders, disrupt insulin type problems. So you need to change your plastics into some non-plastic type of factors. Interesting article from the New England Journal of Medicine, the most prestigious medical journal in the world, January 2009. University of Minnesota study showed that people who donate kidneys live just as long, actually live a little longer, so they actually do better than the normal population. So here's something that can actually give life to somebody. Non-stick cookware increases infertility by 150%. That's in the Teflon type compounds. That was published in Human Reproduction, January 2009. Processed meats increase leukemia. Harvard study showed an increase in terms of 40% increase. Children eating bacon, hot dogs, and sausages, those avoided meat but ate veggies and tofu, also linked to pancreatic cancer and colorectal cancer. And you can read that, or your drug doctor can read that at the British Medical Journal, January 2009. Cosmetic surgeons see huge increase in man boobs reduction. That's a kind of a sad type of thing. University of, actually United Kingdom study looking at over almost 35,000 procedures. There's actually been an increase, 44% and 1,000% increase since 2000 because men are increasing their fat. Fat produces through an aromatase type of pathway that converts testosterone, which makes them a man, into estrogen-based compounds, and plus increase their chances of other type of problems. Facelift gets you a pay raise. Yeah, Harvard study showed in the American Economic Review, March 2006, that attractive people make more money. We find a beauty premium, about 10 to 15% increase in terms of income, and I talk about that because in my practice, as well as a lot of natural doctors, we use it's called Spa 2. It's a natural facelift that uses botanical herbs, amino acids, and antioxidants to make yourself look 10, 20, 30 years younger versus using Botox and facelifts. And you can watch that on my TV show. I review that every week about the contraindications and the harmful effects of those particular compounds on napavalleytv.org, 21st Century Natural Health, Monday, 7 to 9 live, and you can archive my shows. Supplementation with soy benefits cognitive function in elderly. University of Wisconsin-Madison randomized control studies looking at a group of people that were ages between 62 and 89 years old, taking 100 milligrams a day of soy isoflavones versus placebo within 6 months showed an 80% increase in cognitive test. Data, quote, this is a quote, data supports the cognitive effects. Aging, Medical Journal, Aging, February 2009. Folate, B vitamin, and breast cancer. Another study from Fred Hutchinson's Cancer Research, the #1 research center in the world, took women ages 50 to 76, and after 10 years showed that those people that had highest levels versus the lowest levels of folate had a 22% decrease in breast cancer. And you can read that in American Journal of Clinical Nutrition, February 2009. And green tea and breast cancer, Vanderbilt School of Medicine, looking at almost 3,500 subjects, ages 20 to 74. Regular consumption of green tea reduces the risk of breast cancer. So, Journal of Nutrition, February 2009. There's something you can drink on a regular basis. Probiotics and chronic fatigue syndrome, something I see in my practice, having great success. Here's a journal article in Nutrition Journal, February 2009, a Swedish study showing that probiotics, these are the good bacteria that you can take, helped 45% of the chronic fatigue patients in 4 weeks. See if that drug that's out there for that works even close to that. Fruits and veggies reduce endometrial cancer. This was in Journal of Nutrition, again, February 2009. People who ate veggies had a 51% decrease. Vitamin E decreased by 44%. Fiber, 60% reduction. Beta carotene, precursor to vitamin A, 55% reduction. Lutein, another type of phytochemical, 52%. And folic acid, which we just talked about, 57% reduced the risk of endometrial cancer. Veggies and tofu versus processed meats and leukemia, Harvard study. These were some Chinese subjects aged from 2 to 20. Those who ate cured and smoked meats and smoked fish increased their chances of leukemia by 74%. Those on veggies, 45% reduction, and on bean curd or tofu, 55% reduction. That is published in Cancer, January 2009. Red meat and inflammation, big couple months ago on my TV show, and also on my website, drnoah.meta-ehealth.com. That's drnoah.meta-ehealth.com. Reviewed this particular type of article that showed that statin drugs are now really jumping on the bandwagon, that holistic and functional doctors like myself have been jumping up and down for at least the last 30 years. That C-reactive protein, an independent risk factor for heart disease, is probably equal to, if not more important than cholesterol, but because drugs were only out there for cholesterol lowering, statin drugs, no big deal. As soon as this drug came out and showed that C-reactive protein, now all the doctors are saying everybody has to do that test. Well, by just once again eliminating red meat, you're able to reduce your C-reactive protein by 209%. Try to see if the statin drugs can, and they can't. So I want to thank you watching this. I'll try to keep a little bit more up to date. Got a little pause there. I'm on once again on NapaValleyTV.org, channel 28, 7 to 9 live. This week I'll be talking about diabetes and have a full 2-hour live show and archive that on. Of course, you can check out my website, probably most comprehensive out there, Dr. Noah, DRNOA dot META meta dash eHealth, EHEALTH.com, and you're always welcome to call me. I'm in both Fairfield and Napa, California. You can call me at 707-224-5488 or 707-426-6135. Thanks for watching. See you next time.